Hi, this is Terry QT with Deep Sea Foundation. I'm continuing my conversation in San Antonio today at the hospital. Fair warning, if we get some squawking over the intercom, we're going to stop briefly so you can hear our voices. They invited me to come up to the hospital during their breaks today to do some quick videos. So we're with Ramon Garza from PRMA in San Antonio. So thank you very much for joining us today, Dr. Garza.
Thank you for having me.
Yeah. So we're going to continue our talk about lymphedema. And what I want the viewers to understand is that the earlier you catch symptoms, the more treatable it is. So he's going to talk to us a little bit about the function of the lymphatic system. He gave me a great explanation, and I said, I really want you to tell our viewers about that.
I'm happy to.
Yeah.
So the lymphatic system really has two functions. Number one, it's part of the immune system. So I'm going to use the analogy of what I just described with Terry as an injury to the hand. So somebody has a cut on their hand, and bacteria, invade the little cut. So our lymphatic system and our immune system works in a way that the white blood cells in our immune system will go to the area of the cut, and they'll capture this bacteria, and they grab it, and they travel via the lymphatic system, via the lymphatic network and channels, and they go to the lymph node basin. And in this instance, it'd be in the armpit area where we have our axillary lymph nodes. These same lymph nodes which are removed during breast cancer treatment sometimes. So they go to the armpit area and they say, hey, lymph node, I caught this bacteria. Is this something that's bad? Is this something that we need to worry about? And the lymph node says, yes, that's a bacteria. Let's mount our immune response. So then they will send the white blood cells via the circulatory system. The white blood cells go to the area, and that's how the immune system gets kind of triggered.
Right.
The other function of the lymphatic system is management of fluid. So when the lymphatic system is being developed, it will, in embryology, they follow the sources of the veins, so they follow the same network as the veins. So the arteries, veins, and lymphatic system kind of are developed in a similar fashion.
We're an internal roadmap, aren't we?
We really are. It's fascinating. I love anatomy, and I love the physiology of these things. And as microsurgeons and plastic surgeons, our main field revolves around blood supply. So
Right.
That's just kind of maximizing that knowledge and using it to treat disease. So when the lymphatic system was developed, its primary function with the vasculature is management of fluid. So the lymphatic system does not have any red blood cells. It has plasma fluid, interstitial fluid, and it also has white blood cells that we talked about earlier. So the red blood cells will travel via the arteries and the veins. The veins are returning blood back to the heart, and the lymphatic system is returning the interstitial fluid also back to the systemic circulation, back into the heart. So when someone has had axillary surgery, removed lymph nodes, that lymphatic channel network can no longer cross that scar tissue basin. And when it becomes so overwhelming for the system in the arm, for example, that manifests as lymphedema. So that's how the patient was developed.
Almost dams it up.
Exactly. Yeah, you hit the roadblock, it dams it up,
Mhm.
and now you have
Backup.
this backup that presents as swelling in the arm or lymphedema.
Yeah. All right. Thank you so much for doing that.
Yeah, no problem.
Yeah.